Hello, my name is K Osburn. I'm an EKU MSN student currently working on my family nurse practitioner degree. Right now, I work as a registered nurse on a cardiac floor. Most of our patients have been diagnosed with congestive heart failure, and unfortunately, a number of these patients are readmitted with congestive heart failure exacerbation. Self-care is huge in patients with heart failure as they must manage their diet, their exercise, and their medication routine. I've discovered that I'm often asked the same question by heart failure patients, and I feel as I have began to develop an understanding as to why patients face deficits in their self-care routine. I formulated a PICO question to help explore heart failure patients. In chronic heart failure patients, how does the patient receiving heart failure management from the trained primary care provider compared to traditional follow-up with only a cardiologist affect the patient's quality of life within 1 year? Heart failure is important because it is so widespread and is associated with frequent hospitalizations, poor quality of life, high mortality, and less than desirable self-care behaviors. Heart failure is the #1 diagnosis of hospitalized patients over the age of 65. It's estimated that 5 million people are currently living with heart failure, and an additional 550,000 cases will be diagnosed each year. 4 studies were reviewed in an attempt to answer this PICO question. The first one was a quantitative quasi-experiment. There was 23 participants, and each patient had an average EF of 47%. The intervention group received education from their primary care provider and more frequent follow-ups due to their diagnosis of heart failure. An analysis of covariance measured the baseline and post-intervention data. This showed that there were statistical significance improvements in the patient's quality of life, health, and function who received the intervention from the primary care provider. A second study was a pre-test, post-test experimental design taken place in rural Alabama. The intervention group received frequent telephone follow-ups from an advanced practice primary care nurse. This nurse prescribed education and information for patients with heart failure. A mixed model analysis of variance was conducted post-test and measured the readmissions, quality of life, and self-care behaviors. There was statistical significance in improvements in these measured outcomes. A third study performed was a randomized prospective open-label study with 160 total participants. The intervention group received heart failure education and more frequent follow-ups from a primary care provider. The primary care provider provided the patient with booklets, an open line of communication, and community resources for managing their heart failure. The control group in all these studies only received this traditional cardiology follow-up. Analysis of this current study was measured with the student's unpaired and paired two-sided t-test. There was statistical significance indicating that the intervention group had benefits in improved cardiac function, reduced BNP, and an improved quality of life. The final study was a total of 197 heart failures participating in a cluster randomized controlled trial. The interventions group per primary care provider worked closely with a cardiologist, had more frequent follow-ups, and had group education sessions for the patients. The quality of life for these patients was rated with a Minnesota Living with Heart Failure tool, and these patients had an improved quality of life. Heart failure patients benefit from having regular follow-ups is the whole point of this synthesis. The primary care provider should have heart failure knowledge and resources to offer the patient instead of referring everything to cardiology. The primary care provider and the cardiologist can work closely on patients who have congestive heart failure to increase their quality of life and decrease their hospital readmissions. Advanced practice nurses who implement heart failure education and correlate care with cardiologists will be applying the results of this review to improve nursing practice. Encouraging frequent follow-ups and offer supportive researches, whether it's booklets, telephones, communication, can really help patients understand the pathophysiology of heart failure and the importance of complying with their routine. The main intervention from this study to take away is communication. Developing communication with the other healthcare professionals, because nursing is interdisciplinary, is so important. The primary care provider who establishes a rapport with the congestive heart failure's cardiologist shares information, and new medication changes or discontinuing of medications can really benefit the heart failure patient. Communication is important with the patient so that the patient understands their diagnosis and the importance of follow-up and diet and medication management. and also communication for the patients and community resources, such as cooking classes and exercise programs. Establishing a rapport will really go a long way in caring for these patients. The family nurse practitioner who has heart failure patients should take an active role in correlating care with a cardiology and offering heart failure education at each follow-up. Thank you.